that is. So welcome everyone today. This is the last COVID-19 Lecture and Learn series sponsored by AHEC. We have the amazing Dr. Shira Gabriel here today. We're going to be discussing social isolation. As a reminder, if you've attended any of our previous meetings, or if this is your first time attending one of our meetings, we will be taking questions either through the chat. Once we get towards the end, you can unmute yourself and ask your question if you feel more comfortable with that. You can personally message me in the chat. It's really up to you guys. We don't have a lot of people today, so it'd probably be easier if you guys unmuted yourselves, but I'll leave it up to you. So welcome everyone. Today we have Dr. Shira Gabriel discussing social isolation. Dr. Gabriel is an associate professor of psychology at University of Buffalo. She is a social psychologist and internationally renowned expert on the social nature of the self. Dr. Gabriel is the editor of Self and Identity, the primary journal of the International Society for Self and Identity. She has received funding for her research from the Templeton Foundation, the Social Science Research Council, and the Russell Sage Foundation. Dr. Gabriel received her PhD in social psychology from Northwestern University in 2000. She studies how social surrogates fill belongings, needs, the relationship of religion to the social self, and the importance of immersion in large crowds for well-being. And fun fact, I was actually a research assistant in one of Dr. Gabriel's social psychology labs back when I was an undergrad at UB, so kind of full circle. So Dr. Gabriel, I'll hand it over to you. If you have slides, you're more than welcome to present them, share your screen. I'll let you take it away.
Awesome, thank you. It's good to see you again. Thanks for inviting me. Yeah, I will share my screen and just talk for a little bit, and then, yeah, I'm happy to answer questions too. Okay, did that show up? Awesome, okay, good. So today I want to talk about social isolation during COVID-19. Why does it matter and what can we do about it? So as we all know, life is weird right now, and all the normal things that we do in order to connect to others are more difficult. And a lot of researchers have worried that there are negative implications of these social distancing guidelines for well-being. And there's reason to worry about this because we're a very social species. So research within social psychology has long supported the idea that the need to belong and to connect to others is a fundamental human need. That social connection is really strongly linked to happiness, and a lack of social connection is really strongly linked to negative outcomes. And this makes sense because evolutionary biologists believe that humans evolved for group living, that we're an ultra-social species. So if you look back and you compare humans to other apex predators, you'll see that, you know, our claws don't really compare at all to their claws. And we have teeth, they can bite things, but we can't just destroy things with our jaws like other apex predators. We're kind of strong, but not really strong like other apex predators. So that makes you wonder how we've survived and thrived as a species. And biologists believe that part of the reason that we did this is because we're so social, because we lived in collectives. So if humans had lived on their own, we never would have survived against all of those much, much stronger animals. But we survived by banding together and living together and hunting together and protecting one another. So we evolved to be social. Even language, even the fact that we have this complex language is a sign of how social we are. We need the language more so than other species because we need to be able to communicate with other people. So we're highly driven towards social interaction. So this time in history is a little tricky because we worry about what happens when our social interactions are limited due to health concerns. And in fact, we have seen reported rises in symptoms of anxiety and depression in the early summer that really strongly mirrored the increase in COVID cases and thus social isolation. The same thing if we look at the weekly COVID cases in the summer and the fall, we can see that it really strongly mirrors reported symptoms of anxiety and depression in the fall. So as people are limiting their social contacts in order to stay healthy, we're seeing that mental health is decreasing, and that is a concern. And so one thing we worried about in my lab is whether lower well-being is inevitable during these times of social isolation. And we thought that there might be ways that people could counteract it by using non-traditional social bonds, which is something we've studied in our lab for a long time. So we've looked at ways that people can connect that aren't the ways that we normally think about connecting. So for example, I'll tell you about 4 of these today, just briefly, that we can connect to others through narratives, like books and TV shows. We can connect to others by items that remind us of people we care about. We can connect to others through parasocial relationships, so bonds like with celebrities or other people who we don't actually know in real life but are around, and we can get information about, and we can connect to others through a sense of collective effervescence. So the first area that we've looked at in our lab quite a bit is how people feel a social connection through narrative. So if you read a book or watch a TV show or a movie, how you can get a sense of social connection from that. So again, like, we're this very social species. So the idea is that, you know, at the time when we evolved as a species, when we did most of our evolving, there was no need for us to distinguish between the real relationships that we have in our lives and these sort of fictional ones. So if you immerse yourself in a television show and you get really into it and you know the characters and the stories, your brain isn't really equipped to differentiate between that kind of world that's presented in the book and the actual worlds of your actual friends. There'd be no reason for us to have a mechanism to do that kind of thing. So even though we know logically that we aren't really in these social worlds when we read books and watch movies and television shows, it feels very real to us. And our research suggests that not only does it feel real, but it makes us feel better. So if you look at these blue bars here, these are people, this is the amount of negative mood people felt in one of our studies. And this group over here are people who were asked to remember about a time when they felt lonely and isolated. And you can see that they have much higher mood than this one here, where they weren't thinking about a time when they were lonely or isolated. That makes sense. But when we let people think about their favorite TV show, these red bars here, that effect completely went away. So these favorite TV shows, and according to this and many other studies in our lab, seem able to protect people from some of the negatives of loneliness. How do they do it? They do it through something we call narrative collective assimilation, which is that when we experience narratives, we psychologically become a part of the collective described within. So if you read the Harry Potter books, for example, it's not so much that you feel like Harry and Hermione are your friends, but you feel like you're like almost like a student at Hogwarts, like you're like a wizard in that wizarding community while you're reading it, and that makes you feel really good. We really enjoy that. And there's a lot of evidence for this from psychology that we very easily connect to groups. So there's all this really cool research showing that if you prime people with groups they don't belong to, they sort of shift themselves in little ways to be more similar to that group. And if I just tell you like, oh, I'm making groups based on people wearing red shirts versus blue shirts, all of a sudden you're like, yeah, I'm a red shirt person, I'm a blue shirt person. Like, we're super groupy, which makes sense based on what I talked about before, right? That we need groups to survive. So I'm not talking in a lot of details about our studies, but I'll tell you a little bit about this one just because it was so fun. We had people come into the lab and read for half an hour, either from the Harry Potter books or the Twilight books. So the Twilight books are books about vampires, and the Harry Potter ones are ones about wizards. And then we measured how they identified themselves. So not how much they were thinking about wizards or vampires, but how much they identified words like me and I and myself with words that had to do with vampires and wizards. How much were they actually thinking about themselves as a wizard after reading Harry Potter? And we found that they really were. So these are actually not that meaningful if you don't do this kind of research, but these are really big effects. So basically what we find is the higher scores on here are the more people identify with vampires, and the lower scores are wizards. And so after people read the Harry Potter book, they identified themselves as wizards. They were more likely to tie the words like me and myself and I to concepts related to wizards. And the opposite happened with Twilight, where they identified themselves as vampires. And even more cool for us, that the degree to which they did this was linked to being really happy in their lives and being in a good mood. So this is one of the reasons we think that we enjoy these narratives so much. And we're also drawn right now to like binge watching shows on Netflix and Hulu, is because they give us this sense that we're a part of the group, and that makes us feel good. Another way we can do this is through comfort foods. So comfort foods, our research suggests, are foods that we were fed by people who cared about us, by our parents, or when we were kids. And eating those foods can make us feel that connection, and cooking them too. Lots of people during quarantine have been baking more. I know I've been baking much more than I usually do, and trying different recipes. And there's a reason that we're doing that. We do it because it does help us feel more connected. So our research suggests that comfort food can protect us from the effects of rejection. We have studies that show that when people, again, are feeling lonely because of some kind of rejection threat, thinking about their favorite comfort food makes that effect go away. So that's another way that we can make ourselves feel connected in these tough times. Another way is through parasocial relationships with celebrities. So even though we don't really know celebrities, we live in a world where we're exposed to them so much that we can almost feel like they're our friends. And so reading up on them and watching, their videos online and retweeting or following them on Instagram and communicating with other people makes us feel like we know them. It makes us feel like they're our friends. And we've looked at this in the lab too. We actually looked at it with President Trump because he was a celebrity before he was president. So we thought maybe when people watched him on The Apprentice for years, it made them feel like they knew him and he was somebody who was like in their social world, even though they knew logically he wasn't. They felt like that, and that made them more likely to vote for him. And that's just what we found. So people who watched The Apprentice for years, that show that Trump was on, were much more likely to form these parasocial bonds with him. They actually felt like he was their friend and he knew them. This was taken before he became president. And because of that, they had really positive attitudes towards him. When in the run-up to the 2016 election, they were more likely to say like, oh, he doesn't really mean that stuff that I don't agree with. I think he, is just this great businessman, like they presented him on the show. And it actually also predicted voting for Trump, in particular for those unlikely voters, those Obama voters who then voted for Trump. We found that a lot of them had been people who had watched The Apprentice and felt like they knew him. And so these bonds with celebrity can feel like bonds with real friends, the same way you feel like, oh, I really know my best friend and she is somebody who I understand. When we're exposed to somebody on television again and again or through other media, we feel like we really know them. And it's not only Trump, it's any kind of celebrity who we follow and interact with online can give us this sense that we know them. And right now, that can be sort of a positive thing, especially for people who are isolated, because it can give us a sense of connection to the world. We can also feel a sense of connection through something that Durkheim called collective effervescence, which is like that amazing feeling that we get when we're engaged with other people in a group setting. So like if you're at a concert or if you're at church or a rally or a festival and you're with a bunch of people and you get this great sense that like something special is happening and you're really connected. You might think like, oh my God, there's no way people can experience that now during COVID because we can't be in crowds. That's like the last thing that we can do right now. But actually our research on this, even before COVID, showed that people often have these experiences from small events too. Like we thought about it in these big things, but people said, no, I get this feeling of connection and like something special is happening in little times. Like I'm waiting in line and everybody shares a little joke, or I'm walking down the street and I feel like I'm a part of the city and I'm connected to the people, or I'm riding the bus and something funny happens and I see people around me laugh all together. So these little events can lead to collective effervescence too. And having these sorts of experiences is really good. It does reduce loneliness and give us a feeling of social support and spirituality. And so those are good things. So we have all these different ways of filling the need to belong that aren't the traditional things that we can't do right now. Things like engaging with narratives and bonds. And one of my former students is looking at how we use music for this. And other labs have looked at how interacting with strangers can fill the need to belong. So we've done some studies where we measured how much people did all these different things. And what we found is that most people fill their need to connect to others through a wide variety of means, not just through traditional ones. And in fact, it doesn't seem to matter how you do it. The point is just that you do it. So you don't need to feel like one kind is better than other kinds. And I think that's a problem in our society, is that we sort of emphasize like, to be happy, you need to have a romantic partner and you need to have a family. And for some people that works and that can be a great source of happiness, but our research suggests that there's a lot more flexibility than that. And in fact, it's best to have a combination. So it's best to both have these more traditional means and non-traditional means. Those people tend to be happiest. So we looked a little bit back in the spring when everyone was quarantined to see if people used these non-traditional means. So again, we've got this weird situation where we have these social distancing guidelines. We wanted to know, are people able to use these non-traditional means to feel better? So we were fortunate that we had a sample where we had their well-being, their happiness, and life satisfaction from before COVID. So we were able to control for that and see, like, do we see changes in how happy people are? And are they able to negate negative things by using these non-traditional means? So we measured social surrogate use, something a lot of us were doing and still are doing, things like watching our favorite TV shows and eating our favorite foods. And we also measured collective effervescence. And what we found is in our sample, people were mostly finding this through these like online video things. People were like Zooming and with their family or friends or other people. And sometimes those experiences were awful, but sometimes they got this nice sense from it as if they were connected to others and it was sort of special. So sometimes they had collective effervescence even through these non-traditional means. And then we just measured how much they felt connected to others. So do they still feel like they're a part of the social world? We measured their well-being again controlling for well-being from before. And we measured whether they were following the rules. Are people really staying home? Because that's one thing we wanted to look at is like, if we can make people feel connected, even during these tough times, will they be more likely to stay home and keep themselves and other people healthy? So we did indeed find that the more people had these collective effervescence experiences, the more they felt like they were connected to the world, and the more well-being, the less negative symptoms they had. It also made them stay home more. So people who had these sort of cool online experiences felt as if they were still connected to the world and were more likely to follow the COVID-19 guidelines. In addition, we found that the social surrogate use, so watching our favorite shows and eating our comfort foods, reading books, all of those sorts of things directly fed into well-being. So we do find that well-being is strongly associated with non-traditional means of social connection. That was neat. And we also found that the more people feel connected, the more likely they are to feel good, but also the more likely they are to follow the rules. So humans are highly social, but we're also highly flexible. And the highly social is problematic right now, but the highly flexible is good. So if I was going to give people advice based on our research for surviving this physical isolation, I would say the first thing you want to do is just acknowledge that it stinks and that it's hard, and don't pretend like this isn't very difficult. You also want to remind yourself that this won't last forever, and this is especially true now that we have vaccines coming. And you want to find ways to connect to others. So even sometimes when you don't feel like it, you might want to push yourself a little bit to call somebody or to set up a Zoom with old friends. You also want to allow yourself to use these alternate ways without feeling guilty. So what we find is that sometimes people get negative effects from watching lots of TV during these times of isolation because they feel bad about it. They feel like they're wasting time. You are not wasting time. You're taking care of yourself when you sit and read a book or watch your favorite show. It's important, especially now. So read books if you like to, watch TV and movies, eat your comfort foods and bake. Don't overdo it, because one day we have to go out in the world again. You don't want to have to buy all new clothes. Engage with online communities. So take advantage. Don't feel bad about using your social media, especially if you communicate. Don't just scroll through. That tends to depress people, but actively talking on social media helps. Find ways to make video socializing fun. So Zoom calls can sometimes be awful, but they can also sometimes be fun. So try and reach out to people who you normally don't communicate with, and maybe you get to because we're all stuck at home. We have found in our lab that groups that are between 3 people and about 7 people tend to be best. So you don't want to have just these very small groups, which tend to not work as well, and very large groups tend to be difficult. So try and keep them somewhere in the middle if possible. Turn off your self view. So it's very unnatural to be watching ourselves while we're talking to other people. It makes us self-conscious and it requires a lot of cognitive resources. So when you're on Zoom or other sorts of communications with others, make an effort to turn your self view off. So it'll make it more enjoyable for you. And think of activities to do too. Sometimes Zoom can be more fun if you have like a game to play or questions for everyone to answer. It's a little bit artificial. It takes a while to get used to this different way of communicating, and activities like playing games can help. And be okay with imperfect. Sometimes it's going to stink. Sometimes you'll be excited about a Zoom, and then afterwards you'll be like, that was awful. That's all right. Maybe the next one will be better. Finally, another thing that other labs have found that can be really useful for raising our mood is to do kind things for others. So if you have free time, if you find yourself sitting around, you can bake cookies and send them to friends or leave them at their doors in a safe way. You can write cards, make packages for people. You can knit sweaters for people. Whatever it is, if you have the time right now to do, to fill some of your free time with ways to be kind to others, that is not only will it help them, but it's like a real cheap and easy way to feel better yourself, the research suggests. All right, and that is then, so I'm going to stop screen sharing.
If anybody has any questions, I'd like to get right into it. I know I have a couple of my own, but I don't want to monopolize the entire conversation. Please submit them through the chat. Please unmute yourself. I'm really interested to see what questions we have from today's presentation. I feel like a lot of those things that you brought up, Dr. Gabriel, were things that I think I felt guilty about doing like prior to COVID, where I was like, I don't have time to read a book. Like, it's go, go, go. But now I'm home all day. So it's like, I am going to indulge in reading like a chapter of my favorite book or something like that, going through my Twitter feed and actually like paying attention to the tweets. Anybody want to ask a question? You can go ahead and unmute yourself.
I don't have a question. I thought that was like just super, super interesting. So thank you for sharing that information. And I was just thinking, like, while you were talking about like my own experiences, like, cause I love to read, and I think I do experience a lot of like what you were talking about with the parasocial relationships. And I think I've always kind of gotten like some sort of like benefit from that. Do you think, I don't know exactly how to like phrase this, but do you think that people who are like more introverted rely on like those types of methods more, or like, do you see any type of correlation with that? I'm just curious.
Yeah, that's such a good question. So we actually have that data, and I didn't talk about it today because it's just too much, but a former student of mine, actually a few former students of mine, ran a study where they did show that introverted people were more likely to use these methods than extroverted people in normal times. So when we have lots of options. But in our research during COVID, we did not find that introverted people were more likely. And in fact, we found that extroversion predicted using these things more when they were stuck. So extroverts seem to be finding ways to connect even without. So they seem to be like really diving in on using these things more than they usually do to fill what is for them like more of a need for social stimulation. Whereas this is something that introverts sort of came in already doing. So in pre-times, introverts might have done this more, but now we're actually seeing extroverts are using these things more. And I think at the beginning, people were really worried that extroverts would suffer much more than introverts. And one of the reasons that we find in our data that, yeah, extroverts have had a bigger drop in well-being than introverts, but generally extroverts tend to have higher well-being than introverts for complicated reasons. And we still actually see that. So even though extroverts have fallen more than introverts, extroverts are still doing okay. And we think in our lab that one of the reasons for that is that the extroverts have been really good about being flexible and scheduling Zooms with high school friends and college friends and, you know, neighbors, anybody, like reading, watching favorite shows. They've been really good about finding these flexible ways to do stuff.
That's really interesting. Thank you so much.
Oh, thank you. That's a great question.
So I had a more specific question pertaining to like the elderly population. My grandma just recently lost her husband, and because of everything, like she's been pretty much like alone, like we've like, you know, in the hallway or whatever, but we recently like we've had to just self-isolate her because one of our uncles was in contact with someone. So for people that are older and don't necessarily like have the capability to like read all the time, I feel like the only thing she has access to is like a TV, and like that gets boring. And like it's not like elderly people like are the best with like technology and stuff, as far as like they don't have like the device to do like a Zoom call or like anything like that. So how are you seeing like it work with elderly people, like the best ways for them to sort of combat the isolation?
Yeah, that's such a good question, and I don't have an easy answer to that. We haven't directly studied older folks. I know, like you said, it's sort of like a catch-22 in a sense, because they are the ones who would really benefit the most from using these like Zoom sort of technologies, but oftentimes they're less comfortable with them because they just didn't grow up using those sorts of things. So I think if you're trying to help family members, if there's any way to get them access to any of these technologies, that could be helpful. And, of course, that requires resources too, which not everybody has. But if you're fortunate enough to have them, I think there are some technologies that are designed to be a little bit easier to use than others. So I think Google has like technology that's pretty straightforward and easy and can even be voice activated for people who have a hard time getting on a computer. So that can be like a helpful thing. Phone calls even, I bet they still have landlines. And so phone calls can even be helpful, just checking in regularly. If they can still write letters, writing letters can be helpful. And even finding ways, like it's hard to get pets right now, but if they live somewhere where they can have a pet that they can take care of, that can make a huge, huge difference. So yeah, I agree with you. It's like a really tough thing because the people that could use it the most often don't have access to it. And so any kind of sort of flexible stuff that you can find to help them or like give them even something to do, like if they can knit, you can find an organization that can use a bunch of scarves, and then they can feel like they have some agency or some purpose during this time, or they can sort of dedicate themselves to, like, you can drop off a bunch of wool and knitting needles and they could make scarves for, that could help people who have maybe lost work due to COVID and have kids that need things. So I think a lot of it is just thinking outside the box and trying to find stuff, but I agree with you. It's especially tough.
Thank you.
I actually got a question through the chat, so I'm just going to ask it real quick. So if anyone else has questions, one moment. The question is, you talked about comfort foods as an example of reminders of real relationships. I'm wondering if there are other physical objects that can potentially work as reminders of real relationships.
Yeah, definitely. I mean, we see this the most like in kids, right? So when they start to separate from their moms a little bit, or their dads or grandparents, whoever the primary caretakers are, often they'll take like a blanket, or some like stuffed animal that they associate with those primary caregivers, and holding that will give them a sense of comfort. And we think we outgrow that, but we don't, so we still want objects that remind us of people, and those can be really helpful. And in our research, one of the things that we've looked at is even just going through and like looking at pictures, like looking at old yearbooks or looking at pictures online or shared albums, can help people like remind them of the connections that already exist in their lives and give them sort of that sense of connection, and particularly if they're feeling lonely. So those items are like direct reminders of people. Sometimes people like even like take a sweater that someone used to wear and wear it and sort of get that feeling of connection to them. So there are many ways that we can do that. In our lab, we looked at food as one way of doing it. But there are many things that people use, and people do this in religion all the time too, right? So you have like a rosary or a cross or, a Star of David, something that is like a symbol of your religion that makes you feel closer to a higher power. And that can be really powerful for people too. So there are all kinds of objects like that, and it's normal and healthy and wonderful to use them, and not something you should feel weird about.
You mentioned religious artifacts. Do you know if any of your preliminary research, or if this is even like on your scope, if people who are part of like a faith-based community or their social networks are heavily involved with their faith, if they're doing any better in terms of social distancing because they have those wider networks?
Yeah, we haven't directly looked at that, but I would be shocked if that wasn't true, So I think a lot of religious organizations have really like taken this on in a really admirable way and provided a lot of online opportunities for people to connect to one another. And they've even, you know, like I know our temple has like people call people who are home because of this and check in on them regularly. And so I think any sort of community like that can be really helpful. And it can also just be helpful to like instill like a schedule for you, which I think is really useful, especially for older people who are home and may not have any kind of schedule built in, and every day sort of slips into the next, and that in itself can feel depressing. And so if you have a church service every Sunday morning and you have a Bible study on Wednesday afternoon, then that like anchors your week in some way. It gives you like a sense of time passing in a more normal way, which is important for our well-being too.
Thank you. That's actually really helpful to know. My grandmother is like very involved with her church community, and she lives alone, so it's like I'm always very worried about her.
Yeah.
But I know that they do like big phone calls and Zoom calls, so I just was wondering if that was like enough. Does anyone else have any questions? I have a couple more, so I don't have a problem asking, but I want to make sure that everyone who has questions or even just comments about presentation, go ahead.
I actually have a question. Do you have any tips on ways that as parents we can make sure that our children are doing okay? I apologize, they're probably if you can hear them in the background right now. They are home, they are doing distance learning, and they're doing pretty good, at least I think so. But I just want to make sure that there's signs that I'm looking for to make sure that, you know, they're still doing okay socially.
Yeah, I mean, that's such a good question. And I feel the same way myself. I have kids that are home and I worry all the time. I mean, I worry always about being the good parent, but especially now when it's so unknown, it's just really tough to know whether you're doing the right thing. And I'm definitely not an expert in child development, but I think, one thing that we always want to look for is changes in sort of behavior of kids. If their eating behavior changes in some way, or their sleeping changes, or, you're seeing something that gives you a sign that something might be going on that they're not talking to you about. For our kids, we've like increased the amount of screen time they're allowed because they use it to connect to their friends. So mine are teenagers, so we let them FaceTime way more than we normally would and play online games because it gives them an opportunity to like interact with other people. And since we're not letting them do any of that outside of the house right now, we're letting them do more of that than we normally do, and trying here and there to like, get those times at home where we feel a sense of connection and like something is special, like do something silly, like everybody dresses up for dinner tonight, or, we have like a silly night where you have to pick a game for everybody to do. It's tricky, especially the teenagers who don't really want to hang out with us. But I'm trying to like instill something special in life for them as best I can. I think overall, children are way more resilient than we think that they are. So I think that if your kids sounded pretty happy running around there in the background when I heard them, and I bet that they're doing well, and that you're a caring parent who's looking after them, they tend to be stronger than we think they are.
Yeah. Thank you for that. I just want to, you just, like you said, as a parent, you just want to make sure that they're good. So
I know
those are great ideas.
Yeah, it's stressful. I feel you because I worry about it all the time.
Yeah, thank you for that.
Sure. Good luck. It sounds like you're killing it. They sound good in the background.
Thank you.
Dr. Gabriel,
I had another question.
Oh, you can go. If this is your time.
So as far as like the teenage population, but like early teenagers, like 16, 17, I have a sister who's around that age, and I noticed that out of my family, she's been struggling like the most as far as like how her behavior has changed, just because she's kind of in the mindset of like being really frustrated because a lot of people aren't adhering to the social distance guidelines in her age group, and we have to be super strict because of like compromised family members. So it's been like taking a toll on her because like she's just mad. She's just frustrated at the world because she wants to be doing things and just kind of like despises everyone right now because like she feels like everyone's just against her. So like for people like that where you can't really give them what they're looking for and like nothing really helps as far as like, you know, connecting in other ways because all they want is to be with like their friends, like what are better ways for them to maybe get themselves that sort of interaction without, I don't know, it's difficult because like people just don't adhere to it like she does. So
Yeah, that's really hard. I mean, I think this has got to be a really hard time for that's a normal time of life to want to pull away from your family and spend time with your friends. Like that's developmentally appropriate. So to be stuck in your house is really tough. And you know, my daughter is 15 and I think has been doing relatively okay, but we've been fortunate that her group of friends also have parents who've been really strict. So like the way they all socialize is by like FaceTiming and like online gaming together so that they can communicate that way. So she isn't like missing huge amounts of things that other people are doing. But when you get into a situation where you are missing, where your family is more careful than other families, then that's hard. And it's really can be very difficult. I think, you know, there could become a situation where it might be helpful to find someone professional for someone to talk to just so that they like are able to deal with and sort their feelings at what is a really difficult time of life to begin with. And it's also, if possible, you know, nice to try and find a way to get them to put it in perspective. And I know that's really hard when you're 16, but like this isn't forever, you know. And I try and tell my kids like one day you'll be able to tell your kids you lived through this, and try and remind them of like Little House on the Prairie where like everybody was stuck like in a little tiny room with just their family for like years on end. And that you know, like I started feeling super guilty about my kids, and then a friend without kids was like, I don't know, if it was 100 years ago they'd be working in the mines, like they got it good. And I was like, I mean, that's a crazy way to think about it, but it's also sort of true. Like we've lived like a really easy life in many ways here in America for a long time. Not all of us, but many people, certainly much more than previous generations that were asked to give up much more. And so I guess I try and give perspective to them, but again, it's really hard to have that when you're in that age because you just don't have that perspective. You haven't lived beyond it. So I don't know. I wish I had better advice for you about how to help her deal with it. If your parents haven't already, you know, I would relax rules on like having her phone and being able to talk to her friends that way.
Thank you.
I wanted to ask, kind of shifting focus a little bit from a provider standpoint. We have people who are maybe interested in pre-health careers or are currently healthcare students. What are ways that they can maybe tap into some of their mental health training and kind of look for patients who might be at risk for social isolation, who are currently experiencing social isolation, and kind of what they can do while making their patients like feel comfortable?
So like ways to help the patients?
Yeah, or just like ways for them to maybe even help themselves.
Yeah,
There's like burnout.
Yeah. I mean, I think not feeling guilty about self-care behaviors is key, you know. So like to give yourself the time to listen to what you really want, and like if you're able to spend that time watching your favorite TV show or relaxing, the best that you can, and encourage in your patients' ways for them to be flexible about things right now, and to not feel guilty about using these alternate means. And then I think like it's really, we human beings have this tendency to not be very good at predicting how we're going to feel in the future. And so we tend to overestimate that we'll continue to feel how we're going to feel, how we feel right now in the future. Like it's really tough for us to see that things are going to change. And it's one of the reasons that it's hard to help people that are depressed. And it's one of the reasons it's hard to understand depression when we haven't experienced it. Like it's very hard to think beyond our current situation. But I think this is especially a time when we really need to just remind people gently but firmly that this isn't forever and that it sucks and that it's awful. And for some people it sucks and is awful way more than for others. And it's okay to be unhappy right now. Like, it's almost kind of normal to like not enjoy this for many people. Like, this is not good. There's a lot of anxiety, economic anxiety and social anxiety and physical health worries. Like, it would almost be weird to be okay and to be like, no, this is awesome. I'm enjoying the plague. It's great. So cut yourself some slack. Like, yes, it's bad and you don't feel good, and that's a normal reaction to a difficult situation. What you need to do is just get through it. You know, like when you're physically sick, you don't say to yourself like, I should be fine. I should be able to run a marathon. Doesn't matter that I'm sick. Like, this is hard. Let yourself not be able to do as much. And if you feel sad about things, you feel sad. That's okay. Try and get outside when you can. Try and volunteer and help other people. Think about the things that make you happy and do them as much as you can. And just keep in mind that this will end. They have a vaccine. It's incredibly effective. We're going to get through this. And so it's okay to feel bad, and let yourself feel what you need to feel. Try and reach out as much as you can. Try and do the things that make you feel good. I hope that's helpful.
I think that's incredibly helpful. We've all been experiencing the same thing for the last 9 or 10 months. I think we all are at the point where we're like, let's just have this be over, like let it be done with. Do you think after we're kind of like back to whatever our new normal looks like, that we'll see this kind of like sudden increase in well-being? Or do you think it might take more time just because like we've been experiencing this for almost a year?
Yeah, I think it's going to take a little time. I think also it's going to take a time to get used to not being panicked when you're with other people. Like, I don't know about the rest of you, but like I watch old TV shows and I see people like crowded in and all breathing the same air. And I'm like, I get nervous at that. I'm like, oh my God, move apart. That's not safe, which is crazy because it was relatively safe back then and it will be relatively safe again. So I think that I suspect that when we're all able to interact again, there will be a level of anxiety that'll be difficult to get rid of because we're so used to it. And it also will take some practice. Like, it'll be kind of weird. Like, it'll be wonderful, but we also should expect it to feel weird. Like, you know, when we're those of us who've been adhering to this pretty closely have not been in close quarters with people outside of our household, especially indoors. Like, a party seems like a crazy idea to me. But I'm also really looking forward to it. And I think we need to know that, like, at first it might feel weird, you know, and we might be like disappointed by it or weirded out because it might take a little while or not. It might be magical. It just depends on the particular situation. But that reaction might be a little strange as we get used to it at first. But human beings are so flexible and also in many ways very in the moment in terms of their circumstances. So I bet it won't take that long before we feel normal again. And hopefully we'll be able to hold on to our gratitude for a normal life for a little bit. That's an unfortunate thing, is we tend to forget that too. We, you know, get so used to everything being normal that we forget, like, we don't always get for it to be normal, but we'll all be happier in the long run if we can think like, wow, I missed this and I'm glad for it.
I can completely relate to the old TV show thing because I'm like, why are you not wearing masks? Why are you so close to each other? Like, you're not about to kiss, like back up.
Right.
So for me, I'm just like, it's so weird to see that like my current reality doesn't match up with a reality that really wasn't that long ago. Like, especially when TV shows were shot earlier this year, movies were shot earlier this year. I remember being at a concert and like, I don't love being super packed in, but like kind of missing that. Like, I miss being with 500 strangers at like an event and maybe experiencing a little bit of that collective effervescence. Like, we're all here together and we're all experiencing the same thing. And like, in a way, I still feel that like when, earlier in the pandemic, my sisters and I would go on these walks and like, we would enjoy our mornings together. And like, it was an opportunity for us to kind of like be together without like mentally all being together, like time for us to kind of enjoy like the sunrise. Like, we're here, we're seeing another day. Yes, this horrible pandemic is continuing, but like, we're here, we're okay. Let's start our day. So I definitely understand what you mean by when I'm seeing those things on TV. It's just like, wow, what a way to live. And I think it's interesting that so many TV crews and like movies are starting to pick up again. And I'm like, that's going to be weird for us to see, you know, that like even the movie industry isn't kind of adopting the things that we have to adopt, like masks. I mean, are we going to see TV shows where people are doing that? I don't know. Maybe there are, and I just haven't seen them.
Yeah. Do you watch Superstore?
No, but my mom does. So maybe do they wear masks on the show?
Well, this past season, I haven't seen, but that's, because they work in like a big store. So I feel like they sort of dealt with it that way. Like they all have masks on because they would have masks on if they were in a store. So I thought that was like a clever way to be able to still film a show. Yeah, it's a great show. I like it. And you can binge watch it now, which is like, I find really enjoyable at this time, so then you really immerse yourself in the social world. You really feel like you're like in there, and I don't know.
As soon as the semester's over, I have like 17 things on my TV plate that I'm just going to take a deep dive in, because not only has the semester been a little stressful, I mean, with distance learning and everything, my roommate and I moved into a new apartment in like November. So it was like, we've got the stress of school and like a new move, a new setting. So I've got a list that I've been like going to tack all of them out once the semester's over. But I wanted to give anybody else the opportunity to ask last minute questions, last minute comments. We're kind of coming to the close of our meeting. I know that I'm incredibly grateful for you taking the time out of your, I'm assuming, very busy schedule with back-to-back Zooms and whatnot to talk to us a little bit about social isolation. I mean, we've kind of, I think, been dancing around the subject as like individuals, just like not wanting to say we are socially isolated. I attended a meeting. One of my other responsibilities is I work at Roswell, and I attended a meeting through our Center for Indigenous Cancer Research, and they talked about kind of social isolation within multi-generational families. And one of the things that they said is like, we might be physically distanced, but like emotionally, we're still close to everyone. So I kind of try to carry that with me throughout this pandemic. But if anyone else wants to say anything, please take the time now. Any closing remarks?
I just wanted to say thank you again. This was really great.
Oh, I had a lot of fun. Thanks for having me.
Well, if nobody else has anything, I'm going to stop the recording. Like I said, if you know someone who is interested in this topic but was unable to attend today, this will be available through our website soon. I will email everybody when that's up, but you'll all get a link. It'll be shareable. There won't be like a passcode or anything. I know Zoom is sometimes kind of like strict with how we share our meetings, but thank you again, Dr. Gabriel, for taking the time out of your schedule. This was very informative, and I took a whole bunch of notes that I'm going to hopefully use with me throughout the rest of the pandemic when trying to kind of tackle this issue of social isolation within my family and within my own social network. So thank you very much. Thank you everybody for attending. Look out in your emails. There'll be a short evaluation form. This lecture series will actually pick back up again in February. And hopefully we'll have some more interesting meetings for everybody to attend. So thank you so much.
Thank you.
Thank you. This was amazing. Thank you so much.
Hi, Denise.
Bye.